All right, tonight we're diving headfirst into one of the most intense situations in all of medicine. We're opening up the surgeon's survival guide.
I want you to picture this. It's the middle of the night, the hospital's hushed, but not everywhere. In the radiology reading room, a life is literally hanging in the balance. There's a surgeon just waiting because everything, I mean everything, the very next move, the patient's shot at survival, it all comes down to this one image. So yeah, we're talking about a 3 a.m. emergency. And this isn't just any old emergency. It's a flat-out race against time. And in this race, the most precious thing you can have is a clear answer. You know, this quote right here, it shows you something really important, a really human part of all this. We're not talking about sending an email or a quick text, no way. The surgeon physically walks down to the reading room. It's this critical face-to-face moment. The scan becomes the language they're both speaking, and the only question that matters is, are we prepping the OR right now? Okay, so this whole 3 a.m. emergency situation, it has a name. It's part of a really broad, really urgent, and honestly kind of mysterious category that doctors call the acute abdomen.
So what exactly is that? Well, think of acute abdomen like a giant red flashing alarm bell. The body's basically screaming that something inside has gone catastrophically wrong. But here's the catch. It's not specific. It could be a dozen different things. Anything from a burst appendix to a twisted gut to a major artery that's just let go. That intense pain, that's just the first clue in a very serious mystery. So, how often does this kind of alarm bell go off? Well, get a load of this number. 10%. Yep, 1 out of every 10 people who walk or are wheeled into an emergency department is there for severe abdominal pain. Think about that. That is a huge, constant challenge for doctors and nurses in the ER. And this is where the CT scan becomes the hero of the story. It's the detective's #1 tool for cracking the case. The radiologist, they're the detective, and the scanner, that's their high-tech magnifying glass. It lets them see inside, hunt for clues, and solve this life-or-death puzzle when the clock is ticking. All right, let's dig into our first case file. We'll call this one a twisted gut. So the scene is a classic one. A patient comes in, they're in absolute agony, their stomach is bloated, but nobody knows why. It's a total mystery. And that's when our radiologist gets to work. And boom, here's our first big clue. Now, when you look at this scan, you probably just see a bunch of gray swirls, right? But to a radiologist, this is a crystal clear picture of total chaos. That big circular thing you see, that's a part of the small bowel, and it's all tangled up, knotted, and dangerously swollen. It's basically the worst plumbing nightmare you can imagine. The official diagnosis? It's called a closed-loop obstruction. The easiest way to think about it is like a garden hose that's been kinked shut in 2 different spots. Absolutely nothing can get through, so the pressure just builds and builds, the blood supply gets choked off, and the tissue itself starts to die. It's a really vicious cycle that gets worse by the minute. So what makes this so incredibly dangerous? Well, it actually boils down to a pretty simple rule of physics called the law of Laplace. All it really says is that as that section of bowel inflates more and more like a balloon, the tension on its walls just skyrockets. It gets stretched thinner and weaker until it's about to burst. And trust me, a rupture is an absolute catastrophe. So yeah, there is no let's wait and see here. The scan has delivered the verdict, loud and clear. The radiologist gets on the phone to the surgeon and the message is simple. We've got a closed loop, you have to operate now. And that one phone call, it saves the patient's bowel and almost certainly saves their life. Okay, so we've seen a plumbing problem. Now let's talk about a burst pipe. Time to open our second case file. And believe me, this one is even more of a nail-biter. We're calling it a ticking bomb. Okay, take a look at these 2 scans. You've got 2 different views here. See that giant white balloon-shaped thing? That's the aorta. It's the body's main superhighway for blood, and it is swollen up to a terrifying size. But the really scary part? You see that hazy gray stuff all around it? That's blood. A lot of blood. This is a massive internal bleed. The pipe has burst. The diagnosis here is one of the scariest in all of medicine, a ruptured aortic aneurysm. The body's biggest blood vessel has torn open, and the patient is, quite literally, bleeding to death on the inside. Just how bad is it? I think this one number says it all. 80%. An 80% mortality rate. This is as bad as it gets. It's an immediate threat to their life. There is 0 time to spare.
Every single second that passes, their chance of survival just plummets.
Now, when things are this critical, a surgeon needs more than just a diagnosis, right? They need a plan of attack. They need a roadmap. And that is where this scan becomes the real surgeon's survival guide.
Okay, so the surgeon knows the aorta has ruptured. That's the what. But to actually go in and fix it, they need the how and the where. Is it actively bleeding right now? How big is this thing? Where exactly is the tear? Answering those questions is the radiologist's next, and you could argue, their most important job.
And this is basically their pre-flight checklist. This is the stuff the surgeon absolutely has to know before they make a single cut. Is it ruptured and actively bleeding? Check. What's the size and shape? Check. And this next one is absolutely crucial. Where is it in relation to the arteries going to the kidneys? Because that single piece of information can change the entire surgical plan. The answers to all of these questions, pulled right from the scan, become the battle plan for the operation. So you see, in the end, a CT scan is so much more than just a picture. In these critical moments, it's a conversation. It's this incredibly detailed, life-saving dialogue between two experts. It's the radiologist, looking at shadows and shades of gray, and translating them into a step-by-step guide for the surgeon who's about to go to war. So the next time you happen to see one of these medical images, I want you to remember what's really going on behind the scenes. It's not just about cool technology. It's about a silent conversation, a transfer of vital knowledge under the most intense pressure imaginable. So I'll leave you with this question. Is it just a scan, or is it a conversation that saves a life?